My name is Elizabeth Borycki, and I'm a professor in the School of Health Information Science at the University of Victoria. Today, I'm going to talk a little bit about virtual care in a post-COVID era. The future of healthcare is digital. So as we know, the digitization of healthcare is not a new activity. It's been about a 50-year endeavor that started with the concept of the electronic health record, with some of the first pioneers being individuals who were physicians who had computer science backgrounds that later became health informatics professionals. COVID has essentially accelerated the move towards digitizing the healthcare system, and has actually moved digitization beyond the electronic health record towards virtualizing and the use of technology to improve the quality, safety, and speed of healthcare. COVID has initiated the move from islands and silos of digitization towards integrated, available, and ubiquitous approaches to providing virtual care. So we know now technology is a fundamental aspect of providing healthcare from hospital to home and into the community. It doesn't take much to look at the news headlines to realize that if we don't have electronic health record systems or digital care, we don't have healthcare anymore. As we've seen with some of the news reports around hacking that's taken place of healthcare systems. And we know that virtual care builds on other global initiatives that were initiated by the European Union as well as the United States in and around modernizing healthcare around the world and modernizing healthcare facilities. And we also know that aging actually has become an important aspect of digitizing healthcare, in that we've seen an entire generation of individuals who are starting to age. They started using technologies in their homes and now are expecting to have the same level of technology support them in their homes, if not more, to be able to live happy, healthy lives outside of institutions. So we need to have a more holistic and integrated view of health and how technology can enable our ability to be able to be healthy and well in the community. We also have to recognize that large amounts of data will be generated and collected, and we need to create visualizations and analytics that support clinician decision-making at point of care, as well as caregiver and also the individual who's affected, their decision-making. Another thing that's important to recognize is that with this digitization, the complexity of care has actually increased. And this has implications for the safety of care, the ability to diagnose disease effectively, and also the quality of care. There's a really nice report that was published in 2016 by the National Academies in the United States, and they identified that with the increase in the number of technologies that are used in healthcare, sometimes what happens is we actually miss the diagnosis, and that we actually prevent a healthcare professional from effectively being able to diagnose disease at an early stage. So what is virtual care? Virtual care has been defined in Canada as any interaction between patients and or members of their circle of care occurring remotely using any form of communication or information technologies with the aim of facilitating or maximizing the quality and effectiveness of patient care. We know there's a lot of different types of virtual care, and some of you have probably already seen that. You know, it doesn't take much. You go into a hospital, there's an electronic health record, you have a lot of digital tools that are being used by physicians as well as nurses and other healthcare professionals. If you go to your physician, you see them using an electronic medical record. We have telehealth and telemedicine support services across the province that are available at any point in time. We have remote monitoring that can take place. Mobile health is pervasive. There's wearable health that's evolving, as well as integrated digital healthcare systems. And what does that mean? So a little bit about what is a digital healthcare professional. Digital health actually isn't a new term. It originally started off as medical informatics, then it changed into biomedical informatics and health informatics at one point. But Digital Health Canada, which is the professional organization for digital health professionals, identifies health informatics core professional competencies as leading to a digital health professional that can become certified and work in the field. And increasingly, we're starting to see a lot more in terms of programs across Canada that specifically cater to this particular type of individual. Most competencies fall into one of, well, I should say all three buckets that are present here. They're the health sciences competencies, the information sciences competencies, as well as management science competencies. And these are actually being updated even as we speak internationally by the International Medical Informatics Association in terms of identifying additional competencies that digital health or health informatics professionals need to have in order to work in healthcare. There's a number of different types of roles and responsibilities around digital health. This is only a couple of the different types of titles for people who work in this particular area. Many of our health informatics students in the School of Health Information Science move into these roles anywhere from Chief Information Officer to Chief Technology Officer, and also Clinical Informatics Coordinator or Clinical Informatics Specialist. And it's really kind of interesting. I was revisiting some of the data around the differing types of schools and programs that are out there. And it's quite interesting that that health information management and health informatics actually has a large number of schools across the country now that are providing these types of professionals to work in healthcare settings. In addition to that, if you look at some of the statistics, and again, really fascinating because I was revisiting the data around this. If you can see, nurses still represent the largest number of individuals working in healthcare with close to 439,000 people. Physicians represent about 91,000 people who are working in healthcare in Canada. Social workers, about 52,000, but health informatics and health information management professionals are quite large in number. There's about 43,000 of them that are working in healthcare organizations with vendors and in government. And it's kind of interesting. We almost tie in with pharmacists, which we see every day in the community. As I mentioned earlier, health informatics isn't a new discipline. It's been around for about 50 years, and actually the School of Health Information Science and at UVic, we've actually had a program for over 40 years now. And so we were one of the leading programs in North America, as well as we still are in many ways in some areas in the country. This is our faculty. We have people who have differing core competencies in terms of doing research in and around the design, development, implementation, evaluation, and maintenance of health technologies in the healthcare system. And we prepare health informatics professionals to work in the field and, as I mentioned, governments, in regional health authorities, and with vendors. So we have a model that really brings forth research. So our faculty do conduct research. We bring that into the classroom. It comes out in co-op, and then it moves into practice. And as a result, we've been quite successful in terms of disseminating information about differing types of technologies that should or shouldn't be used in healthcare, as well as innovating in around new and different types of technologies around visualizations and algorithms. So what is virtual care research and development initiatives in the School of Health Information Science? As you can see, there's a wide range of them. Our students study at all of these areas as they focus in on healthcare, and they are becoming then some of the up and coming areas, such as, for example, the use of sensing devices and remote monitoring. We are also doing sort of the traditional technologies because, as you know, electronic health records exist in every healthcare organization across this country, in hospitals and clinics and long-term care facilities, and even in home healthcare organizations. So we've done a lot of different type of work in our school. So one of the things we did is we developed a virtual electronic health records lab, where we actually provided students with opportunities to access electronic health records. And this is actually something that's really important because our students design, develop, and implement these types of records, and we need to have the research behind that in order to effectively do that, because as you know, many technology implementations can be unsuccessful, but we want to increase the success of these technologies and make sure that they actually do improve health outcomes and they improve safety and quality of care. Another project that we're working on is we're looking at the use of a mobile app in terms of looking at differing types of moles to identify those ones that may be cancerous and to help health professionals quickly expedite the process of seeking out care with a dermatologist who can actually intervene before the mole starts to become big or start to become more of a concern in terms of the cancer spreading to other organs in the body. In addition to that work, we have a program that is going on right now, and it has been for several years. It's a partnership between the University of Manitoba and the University of Victoria. And what we've been doing is we've been working together as a group. It's an interdisciplinary group of computer science, health informatics, and clinical and biological science students that are looking at designing different types of algorithms and visualizations to support care out in the community. This one actually is kind of interesting because what we're doing is we now have a data science and visualization lab in our department to support our students' education. In addition to that, telemedicine and telehealth are important. Many of our alumni work for services such as HealthLink BC, and it's really important to recognize that that's the new way of delivering care. Although telemedicine has been around for quite some time, we're seeing extensions into the use of mobile devices so that you can have interactions with your healthcare professional directly. And some of our alumni and students have worked on these initiatives. In addition to that, because we're moving beyond the hospital and beyond the home care setting and long-term care in terms of digitizing, there's also the need to digitize the home. As we know, I just recently conducted some research with a colleague in Sweden. We have individuals that are aging out and they've learned how to use these technologies. So we wanted to create a lab where we could identify those technologies that best work for supporting individuals in terms of staying in their home when they're well, and then as they start to develop different types of chronic illnesses and diseases to help them stay well and stay functioning. And we've just recently built this lab, and although you can't see this, there is a lot of instrumentation that's in this lab that we have also integrated into the teaching setting. Our students are using the lab to design and develop different types of environments to support healthcare. In addition to that, we also are concerned with things such as workflow and usability. As you know, there is a lot of different types of software and hardware that's been designed. It doesn't necessarily fit well with the types of tasks that patients or health professionals have to do. And as a result, we want to be able to explore that. We have been doing that for the last probably 20 years. And this is an opportunity for us to further extend that work in terms of bringing that into the classroom because we've been doing it in healthcare facilities around the world for many years now. This is my lab. I'm actually quite fortunate in that I do work around technology safety and risk management. So I look at what is the evidence around design and development of technologies, and how can we create technologies that are safe for use for healthcare professionals as well as for the recipients of that care, which are patients. So some of the technologies that I'm involved in studying include things such as e-prescribing, so the prescribing of medications from your physician's office through to your pharmacist to reduce the number of points of contact and actually reduce the likelihood of errors in your medication. And even electronic medication reconciliation, so looking at what kinds of medications you take in the community and what happens when you go to the hospital and those medications change, and making sure that you get the right medications at every point in your care. So what is virtual care? Virtual care is a part of a modern healthcare system. It involves healthcare organizations such as hospitals and clinics, includes the design, development, and implementation of technologies in healthcare for health. And it's also moving from what I would call a siloed digital health world to an integrated system of virtual care. So one day we will have the ability to transfer information between different parts of the healthcare system effectively, and that's something that we're working on here in the School of Health Information Science, to build a modern healthcare system to support people living out in the community. This is a little bit about me. I just wanted to thank the Michael Smith Foundation, I should say the Michael Smith Foundation for Health Research BC, also NSERC for supporting my research. And I'd also have my Global Laboratory for Digital Health Innovation. I have a team of researchers that are working with me in that area in terms of designing and developing safer systems for healthcare. Thank you.